Hello everybody. In this video lecture, we will cover bones and osseous tissue. And to do it, I'm gonna use this PowerPoint. Right? Okay, so this PowerPoint will be used to help me to cover this topic. So let's go ahead and begin. Okay, I'm gonna pick up my pointer. So functions of the skeletal system include support for your body and for soft organs, protection, protect your brain, spinal cord, vital organs, movement. Your bones are levers for muscle action. You can move because you have actually three systems. You have skeletal system, muscular system, and nervous system. Right, and of course, it's not like other systems are not important, but movement is, pretty complex function that include more than one body system. Storage, your bones store minerals, calcium, phosphorus, and growth factors. Also, function of bones is blood cell formation, and we call this process hematopoiesis. And it happens inside marrow cavities and specifically red bone marrow. And your bones also store triglycerides for energy, and triglycerides are fats. And triglycerides are stored also in the bone cavities, but in yellow marrow cavities. So if you look at this diagram over here, you can see that the skeleton is divided into two main groups by location, and it includes axial skeleton, shown here in brown, and appendicular skeleton, shown here in yellow. Skeletal system also include cartilages, shown here in green color, this blue color. And also another part of skeletal system are ligaments. And what ligaments do, they connect bones to another bones. We can classify bones based on their shape. Long bones, longer than they wide. Short bones, cube-shaped bones. And you find them in the wrist and ankle. So it's a carpal bones and tarsal bones. Sesamoid bones are also short bones, and sesamoid bones are found within tendons. Example would be patella or your kneecap. Flat bones, they thin, flat, and slightly curved. And irregular bones, they have complicated shapes. So in this diagram, you can see example of long bones such as humerus, of course, radius, ulna, metacarpal, phalanges, right, femur, tibia, fibula. Those are all examples of long bones. And another example of long bone would be clavicle. So clavicle is the only long bone that is located horizontally in your body. So here's a flat bone, an example is sternum, and many bones of the skull are also flat. Irregular bones, example giving to you is vertebra, and some bones in the skull, let's say sphenoid bone, ethmoid bone, those are also irregular. And by the way, the hip bones considered to be a flat bone. So ilium is a flat bone. Short bones, example is talus, right? And this is bone of tarsal bones, right? And of course, your carpal bones, also short bones. You don't see here, but here's your patella. This is sesamoid bone. Bone markings. We have lots of bulges, depressions, holes, and they serve as side attachment for muscles, ligaments, and tendons. Also for joint surfaces, and contributes to passages for blood vessels and nerves. So all these bone markings, they have their purpose and their function. Let's say if you're talking about different foramina, this is where blood vessels passes through. If we're talking about, let's say, tuberosities, this is where muscles are attached, and so on. Bone texture. So texture can be divided into compact bone and spongy or cancellous bone. And compact bone is a dense outer layer. So if you look over here at the femur, the outer layer is a compact bone, and spongy is a bone that is deep to compact, and it has honeycomb trabecula. So if you look at this picture here, you can see this is how trabecula bone look like. And this part of the bone called trabecula has a lot of cavities, and this is where red bone marrow is found. And this is cortical or compact bone, and it has these distinct units called osteons. This is typical long bone, and you can see different parts of it. So long bone has diaphysis, that is a shaft, right? And it has two epiphyses, proximal and distal epiphyses. So in the diaphysis, we have compact bone collar surrounding medullary or marrow cavity, and medullary cavity contains fat in a yellow marrow. So medullary cavity with fat inside. Epiphysis, so we have, as I already said, proximal and distal, it has a spongy bone and epiphyseal line over here, you can see right there, and this is the remnant of growth plate. So when we kids or very young adults, I would say teenagers, right? We have over here, instead of epiphyseal line, we have epiphyseal plate. And it's actually not bone here, that in epiphyseal plate. An epiphyseal plate, it's a cartilage. And this cartilage divide and allow your bones to grow longer. But when we adults, when we reach, the age when our bones don't grow anymore, then this epiphyseal plane disappears and it's ossifies. So it became a bone now, and whatever is left called epiphyseal line, right? And what cover epiphysis is articular or hyaline cartilage, and this is where joints are formed. So those bones, they form joints with another bone, allow us to move our, parts of our body. Bones are covered by connective tissue membrane. One of them is periosteum. Periosteum is outer fibrous layer, and it does has outer fibrous layer. Periosteum is outer fibrous layer, right? So it's right here. So that's a periosteum. But periosteum itself has two layers, outer and inner. And what is in the inner periosteum layer, we have osteogenic cells. We have osteoblast, osteoclast, and stem cells. And osteoblast are bone-forming cells, osteoclast, bone destroying cells, and osteogenic cells are stem cells. They can differentiate into osteoblast, right? So again, periosteum is outer layer, but periosteum itself has outer and inner layers, and inner layer has those osteogenic cells. Also, periosteum has nerve fibers, nutrient blood vessels, lymphatic vessels. Well, I'm not sure about lymphatic vessels. I think there is no lymphatic vessels in bones, but let's just leave it nerve fibers and blood vessels. and they enter bone via nutrient foramina. Right, so you can see here the nutrient artery, and it enters the bone through the opening, a hole that's called nutrient foramina. Now this periosteum is attached to a bone surface by fibers that are called Sharpey's fibers. Okay, so we just talked about periosteum covering the outer surface of the bone, and it's actually shown over here. And it's good because it's also show you this inner layer, right, where we have all these osteogenic cells. And you can even see this artery entering the bone. But inside, we have another membrane called endosteum. That's a delicate membrane on internal surface of bone, and it also contains osteoblast, osteoclast, and stem cells. Okay, so structure of short, irregular, and flat bones. So periosteum covered compact bone on the outside, right? So we have our periosteum, then we have our compact bone. And we have endosteum, covers spongy bone within. So endosteum would be found within the bone. So right here, it covers, all this trabecula as well. So spongy bone in flat bones has a special name, diploid. And it's made of trabecula. So you see this structures that make it look like a sponge, those called trabeculae. And between these trabeculae, we have bone marrow, right? So what do we know about flat bones? The spongy bone is called diploid. We have compact bone. We have periosteum, the same as the long bones. Endosteum covers the spongy bone within. And this spongy bone is called trabecula. And there is a bone marrow inside. Location of hematopoietic tissue. Hematopoietic tissue, this is where formation of blood cells happens. We call it red bone marrow. So in adults, we will find it in trabecular cavities, so inside the spongy bone of the heads of the femur and humerus, and also trabecular cavities of the diploid or flat bones. In a newborn infants, medullary cavities and all spaces in spongy bone. So what it means, if you take, for example, humerus, right? In adults, in the medullary cavity, in humerus, you will not find red bone marrow because it will be replaced by fat. But in newborn, in infants, you would find red bone marrow in humerus, in medullary cavity. Skeletal cartilages. Skeletal cartilages are also part of the skeletal system. Cartilage does not contain blood vessel or nerves, and that's why it's very hard for cartilage to heal. Any part of your body that really does not have a lot of blood vessels, so there is no ability to bring oxygen, nutrients in a sufficient amount. Well, it's sufficient amount, of course, to keep it alive, but any tissue without blood vessel, you always expect it to be a little bit harder to heal, right? Well, we could say epidermis heals pretty good, right? But epithelial tissue, it just has this tendency to heal very well, to regenerate. But cartilage does not heal very good. So on this diagram, you can see hyaline cartilage, right? This membrane covering cartilage is called perichondrium, and perichondrium contains blood vessels to deliver nutrients to the cartilage. So we have three types of cartilages. Hyaline cartilage, the most abundant type, and provide support, flexibility, resilience, elastic cartilage, similar to hyaline cartilage, but contains elastic fibers, and fibra cartilage. Fibra cartilage contains lots of collagen fibers and have great tensile strength. So hyaline, elastic, and fibra cartilage. And on this diagram, we can see where those cartilages are found. So hyaline cartilage shown here in blue. So pretty much, found in all synovial joints, right? So here's the joints. And it's also the cartilage of your ribs, costal cartilages, cartilage of your nose, right? And if you're looking over here, your larynx, trachea, bronchi, right? That's cartilage is hyaline cartilage. Elastic cartilage, you will find it in pinna, or your external ear, and epiglottis. And fibra cartilage, you would find it in intervertebral discs. And here we have pubic symphysis. That's fibra cartilage. So the most common is obviously hyaline. Microscopic anatomy of a bone. Bone is a tissue, right? Well, the bone is an organ, but osseous tissue is a tissue. It's a type of connective tissue supporting connective tissue. And as any tissue, osseous tissue made of cells, right? And extracellular matrix. So here's the cells of bones. We have osteogenic cells, and those are stem cells in periosteum and endosteum that give rise to osteoblast. Then we have osteoblast, bone-forming cells. Right, so here you can see stem cells, osteogenic cells. Here's the osteoblast responsible for matrix synthesis. Then we have osteocytes. Those are mature bone cells. And osteoclast. Those cells break down or resorb bone matrix. So here's osteocyte, mature bone cell that maintains the matrix. And osteoclast, bone resorbing cells, the ones that destroy the matrix. And you would ask, why do we need to destroy the matrix? We do it when we're remodeling our bones, and you remodel your bones through your whole life. And also you do it when you need to increase calcium in your blood, because you store calcium in your bones. And now when you need to increase the calcium level in your blood, you resorb your bone a little bit, right? And you release this calcium in the bloodstream. Okay, microscopic anatomy of the bone, and we're talking about compact bone. Remember, we have compact and spongy bone. So now we're talking right now about compact bone. So the structural unit of compact bone is osteon. And osteon is made of lamellae. So lamellae is a tubes. You see how this tube is, right? Or of course, if you look at a cross section, it will be like this circular structure. Those are lamellae. Okay, so let me pick up my pen, or maybe highlighter. Okay, so I'm gonna highlight one lamella for you, right? So here, one. So it makes sense, right? But because it's not actually just circular structure, it's the whole column, right? So here's one lamella. Looks nice and blue, and yellow. So lamellae are weight-bearing column-like matrix tubes. Then we have canal over here that is called central canal. See this right in the middle? That's a central canal. So that's a central canal, central canal, central canal. And this is where we have blood vessels and nerves. Then we have perforating canals, and they run at right angles, and they connect blood vessel to the central canal. Right? So let me exit this. And yeah, so if you look here, so that's an osteon, right? This is another osteon. So that's a central canal. Here's another central canal of the osteon. But you see this structure over here? So that's the surface of your bone. This is nutrient artery. And then this nutrient artery moves through this perforating canal and connects to the central canal artery. So that's a perforating canal. And here's another perforating canal over here. Right, so another structure we need to look are lacunae and canaliculi. Sorry. So lacunae, so now on this picture you see part of the osteon, right, with the central canal. You have blood vessel and nerve inside the central canal. And what we have here, those cells, those are osteocytes. Here's the osteocyte, this is osteocyte. But what's surrounding osteocyte is a pocket of fluid, and this pocket of fluid is called lacuna, right, lacuna. And why do we need this fluid surrounding osteocytes? Because matrix, this is matrix, is very hard. And you know that all animal cells must be surrounded by fluid, otherwise they will die, right? So if you put the cell just inside this hard matrix, it will not survive. So we do need fluid to surround every osteocyte, right? And then these lines over here look like little hairs. Those are canaliculi. And what canaliculi do, they connect all these osteocytes, right? So imagine we get this oxygen here, right, and nutrients through the artery, but how to deliver this nutrient and artery to this cell? Again, matrix is very hard. So oxygen and nutrients will go through this canaliculi, right, to osteocytes. Right, so that's what we have here. We have lacunae, small cavities that contain osteocytes, and canaliculi, hair-like canals that connect lacunae to each other and the central canal. Right, makes sense? Okay, so here's the next one. And let me pick up my pointer. So here we're looking at microscopic anatomy of spongy bone, because what we discussed just previously was a compact bone. So compact bone is made of osteons. Spongy bone has trabeculae, and trabeculae align along line of stress. So this is where you have more stress and pressure on the bone. We would have this trabeculae. No osteons. But they do have lamellae. But lamellae is irregularly arranged. They do have, of course, canaliculi and lacunae, right? So here's how, you know, this lamellae would look like. And here are osteocytes, but you don't see any central canal, right? So that's not osteo. Now, chemical composition of bone. So bones have organic and inorganic parts, right? Organic parts include, obviously, all the cells that we just discussed. Stem cells, osteogenic cells, osteoblast, osteocytes, osteoclast, right? Those are all organic stuff. Another part of organic stuff is called osteoid. An osteoid is organic bone matrix. This bone matrix is secreted by osteoblast. And osteoid will include ground substance, right? Proteoglycans, glycoproteins, and those are molecules that are made from proteins and sugar. And another part of osteoid is collagen fiber. Collagen fibers provide tensile strength and flexibility, right? So we have organic part of a bone, cells, and osteoid. And osteoid include ground substance and collagen fibers. Those are organic molecules. Bones also have inorganic part, and those are mineral salts, hydroxyapatites, mostly calcium phosphate crystals, right? And this take about 65% of bone by mass. And inorganic part is responsible for hardness and resistance to compression, right? When this osteoid provide strength and flexibility. So over here you can see a bone. Without minerals, it would be too flexible. Without collagen, it would be too fragile. So that's why bones have both, and it's perfect balance between organic and inorganic compounds that give bone both enough flexibility, right, and enough strength. Bone development. The process of bone development is called osteogenesis or ossification, and this is formation of bone tissue. Bone formation begins in the second month of development, right, embryonic development. Then we have postnatal bone growth until early adulthood, and then we have bone remodeling and repair through our life. There is two types of ossification. There is intramembranous ossification and endochondral ossification. Intramembranous means bone will form inside, because intra means inside connective tissue membrane, right? So membrane bone develops from fibrous membrane. And this is how flat bones are formed. And clavicle as well, because clavicle is not a flat bone. It's a long bone, but it's formed by intramembranous ossification. Endochondral ossification, you see this word chondral means that bones will form from cartilage model. So the cartilage hyaline model will be ossified. And by endochondral ossification, all the bones below the skull are formed by endochondral ossification. Intramembranous, cranial bones, and clavicle. Now, that's very, very quick overview of the intramembranous ossification. So it begins within a membrane, right? And inside the membrane, we have mesenchymal cells, and those are embryonic cells, and some of them differentiate into osteoblast and form the center of ossification. Then this osteoblast starts secreting matrix, bony matrix, right? And whatever osteoblasts get trapped inside, they became osteocytes. Right, so over here we start forming then trabeculae, and finally develop periosteum. Right, so again, that's very, very, very quick overview. So intramembranous ossification start within connective membrane. Mesenchymal cells differentiate into osteoblast, start secreting matrix. This matrix start be deposited in a specific manner, forming trabeculae, and then periosteum is formed. Endochondral ossification uses hyaline cartilage model, and it requires breakdown of hyaline cartilage prior to ossification. So first model made of cartilage is formed, then this cartilage dies, cells of the cartilage dies, and replaced by bone cells. So here several stages, and you can see that we start with the model, this cartilaginous model, right? And then cartilage is covered by perichondrium, right? Inside the perichondrium, we have stem cells that can differentiate themselves into osteoblast. And this osteoblast start depositing, sorry for that, and this osteoblast start depositing the bony color over here. And also inside, we're forming the primary ossification center, right? Because this cartilage ossifies and dies and start forming the cavities. Then we have a special structure is called periosteal bud, right? So the periosteal bud invades these cavities over here. And periosteal bud has blood vessels, and with the blood, it's actually gonna bring osteoblast over here, and osteoblast starts secreting matrix, and cartilage continue to die, so we develop medullary cavity. At the same time, blood vessels start invade this area of epiphysis, right? And this is where the secondary ossification center appears. And at the end, diaphysis ossified, epiphysis ossified, right? And what is left from the hyaline cartilage is epiphyseal plate, right? So that's the cartilage left over here. And this cartilage continue to divide and grow until you know, early adulthood, when we stop, our bones stop growing in length. So again, very quick overview. Endochondral ossification start with this cartilage model, right? First, bony color develops in primary ossification center. Cartilage in the ossification center dies, right? It's calcified and dies and forming cavities. Then we have blood vessels that invade those cavities and bring osteoblast cells, bone cells, and those osteoblasts start depositing bony matrix, right? Also, this medullary cavity continue to growth, and we see the development of secondary ossification center. And finally, we have our epiphysis ossified, diaphysis ossified, with the marrow cavity over here, and what is left from cartilage is epiphyseal plate, and also this articular cartilage on the surface of the epiphysis. Now this, you just can see what happened if you know, there is some mistakes, or I would say some during embryonic development, ossification does not happen. And this is genetic disorders. And this example over here is called Achondroplastic dwarfism. And this is where the endochondral ossification does not work, right? So then bones do not grow in length, and people are born being dwarfs with very short arms and legs, right? So endochondral ossification is impaired. Cleidocranial dysplasia, when during embryonic development, there is problem with intramembranous ossification. Okay, so classification of bone fractures. Bone fractures may be classified by 4 either or classification. We can classify fracture based on a position of bone ends after fracture, displaced or non-displaced. We can classify it based on completeness of the break, complete or incomplete. We can classify it based on orientation of the break, linear or transverse. We can classify it on whether or not the bone ends penetrate the skin, and it will be compound or open fracture, the bone ends penetrate the skin, or simple or closed when there is no penetration. Right, so over here you can see picture of some of the bone fracture. let's say this is transverse, this is also complete, right? And this is also simple, right? So there is no penetration. So this is linear, this is oblique. Well, this is complete and oblique. This one is spiral. Green stick means it's incomplete. So there is no complete breakage through the bone. Comminuted, when the bone is broken into several pieces. So if you look over here, of course, we can use more than one, right? So let's say fracture can be complete and non-displaced or displaced. Or fracture can be complete and linear. Or it can be complete and simple. So we can use more than one of these classification when we're talking about bone fractures. So homeostatic imbalances, osteomalacia and rickets. Osteomalacia and rickets are both diseases that result from deficiency of calcium salt depositing in the bone matrix. Rickets are childhood disease, and it causes these bowed legs and other bone deformities. So imagine if there is not enough calcium when bones are growing, then the person is growing more and more pressure and weight on those bones, especially on the low extremities, then they deform in their shape, right? And it can be either because of not enough calcium in diet or because not enough vitamin D in a diet, because vitamin D is needed for calcium absorption. Another condition shown here is osteoporosis. Osteoporosis is loss of bone mass and bone resorption outpaces deposit. So you destroy your bones faster than you deposit new bones. So here you can see normal spongy bone, and this is osteoporotic bone. So lots of, here it looks like it has lots of, kind of like empty spaces, right? It does start looking like, the person is losing lots of its bone mass. Risk factors for osteoporosis are lack of estrogen. So that happens very often during menopause in females. Also calcium or vitamin D deficiency, petite body form, immobility, low level of thyroid stimulating hormone or diabetes mellitus. Very often osteoporosis affects the spine. So look, that's a normal spine, and here's a spine that progressively became osteoporotic, because look at this vertebra, right? This vertebra losing its bony mass, and as a result, we have this abnormal curvature, right? Called kyphosis. So here the older female with very obvious signs of osteoporosis, and here's her X-ray, and you see over here this and this vertebra doesn't look right? So that's why she has this kyphosis. So treatment for osteoporosis, calcium, vitamin D, and fluoride supplements, increase weight-bearing exercises throughout life. Sometimes they can use hormone replacement therapy, giving estrogen, but this doesn't, they don't use it that much anymore, or they use estrogen together with testosterone, with estrogen together with the, oh my goodness, what is that hormone? Okay, so they use estrogen and not testosterone, but progesterone, sorry. So estrogen and progesterone together, because use of estrogen increase the chances of having breast cancer and uterus cancer. So it's not used so much anymore. And of course, there are some drugs available that increase bone mineral density. Okay, and Paget disease. Paget disease is excessive bone formation. So if you see this patient over here, she has extra bony, tissue growing in her pectoral region. You can see on the X-ray, right, the huge, bigger bones of the humerus and pectoral girdle, also pelvis, femur. But those bones, they are not the right bones. They actually has a lot of spongy bones compared to a normal bone, and they very easily to break. So Pagetic bones has very high ratio of spongy bone. Cause of Paget disease is unknown, and there is some treatment available that increase again calcium and calcium absorption and calcium level in the bones, right? So some treatment is available. Development aspect of bones. Embryonic skeleton ossifies predictably. So fetal age easily determined from X-ray or sonogram. At birth, most long bones are well ossified, with the exception of epiphysis. So if you see over here, this is the embryon, and you can see this darker, right, bones, they already formed, right, they ossified, but then you see kind of like spaces in between look like, oh, there is nothing here. There is actually cartilage here still that will be ossified later. Nearly all bones completely ossified by age of 25. Bone mass, however, decreases in a fourth decade. So when we get older, our bone mass decreases, unfortunately. It's determined by genetics and environmental factors. In old age, bone resorption predominates. So this diagram over here, you can see that what can happen with the mandible if a patient losing natural teeth, right? So when natural teeth are lost, you can see that's 10 years after this happened, right? And you see the mandible is really decreases in size, and we call it face collapse, right? So here's a normal mandible, and here's a mandible that resorbed in an older age, especially if somebody losing natural teeth. So that's how it will look like, right? So also with the old age, the whole skeleton is changing, and it's contribute in our in the changes that can be seen in our muscles and our skin. So when you look at the older person and you think this is just a problem with this person's skin, that's not true. The facial characteristic, facial features, and as everything else, right, our body is changing, and those changes begins with skeletal system, and then muscular system, and the last one is our skin, where we can actually see our age. So let me see, I think that was the last slide. Yes, that was the last slide. Thank you for watching this video, and I hope it was helpful.